Hi everyone, welcome back. Today's lecture is on how to perform pre-rounds in your rotations. I feel that doing pre-rounds is the sort of thing that we all learned the hard way, which is why I believe that this video would be very helpful to most students either doing their clinicals or about to start them. Pre-rounds are mini rounds that students and interns do on their own before the morning rounds start. They are mostly important in rotations like surgery, internal medicine, and pediatrics, basically ward-based rotations. And usually you'll need to start doing these once you start getting assigned your own patients. Your pre-rounds should take place between 6:30 a.m. and 7:30 a.m. so that you're ready before the morning handover. Keep in mind that your patients are typically either asleep or very sleepy during that time and not in the mood for questions at that time of the day. Therefore, keep your pre-rounds short and straight to the point. These are not meant to be comprehensive history-taking or physical examination sessions. In order to see a patient, speak to the nurse responsible for them and make sure it's okay for you to walk in. And once you're in the room, be confident, introduce yourself, and get to work. The smoother and more confident you are, the more you'll get from your patient. So how do you perform a good pre-round? Before you see a patient, make sure to take a look at their file on the system. Things you'd want to look at would be the patient's vitals throughout the night to see if, for example, they had any spikes of fever. You also would want to check the medications that were given to your patient overnight, like painkillers or antiemetics. Check their input and output, fluids, urine, and stool. This is especially important in patients with kidney problems, for example. Check if there are any new lab results or imaging reports that are out. And generally, any notes written down about the patient by nurses or physicians. Remember to note down any findings you come across on a piece of paper or on your phone. Next, you'd want to go to your patient and take a quick history specific to what their condition is. So if, for example, they were admitted with chest pain, you'd want to ask about the pain and see if they are improving on the treatment they're on. Ask if they have any other complaints. If they're a post-op patient, for example, ask them how the surgical wound is. Next, you'd want to ask what we call a set of pre-round questions. It's sort of similar to a review of systems, but it's meant to assess how the patient is doing overnight in the ward. You can use the mnemonic GPS UAE to remember the questions. G stands for general condition. You want to ask your patient how they're feeling. This open-ended question can always reveal problems that wouldn't cross your mind initially. P is for pain. Ask the patient if they have any pain anywhere on the body. Ask whether the patient was able to sleep comfortably at night, and if not, what was bothering them. Ask whether they were able to pass urine and open their bowels. Ask about ambulation and whether they have been able to walk around on their own. And finally, ask them whether they've been able to tolerate oral foods and drinks. Now obviously, this list is very generalized. Some of these might not be applicable to all patients, but it should help you cover most of the questions you'd want to ask a patient in the ward during a pre-round. And finally, if possible, perform a very quick and focused physical examination specific to the patient's problem. A quick abdominal exam or maybe an inspection of a surgical wound. Remember that you will see your patient again with your senior during the morning rounds. Make sure that you are ready to present and to answer any questions. After all, this is your patient and you should know all that there is to know about them. Once you perform 2 to 3 pre-rounds and presentations, this all becomes natural to you. Therefore, try to be proactive and remember that the more you engage with the patients alone, the more you'll learn.